Would you like a second opinion on your diagnosis? Please send your analysis and medical history to visite@qs24.tv, and our Chief of Medicine, Dr. Wiechel, will analyse them for free and anonymous in our new series Ward Round. For more information, visit www.qs24.tv.
A warm welcome to all our viewers to our series Natural Medicine. Today we have the Chief of Medicine of the Swiss Mountain Clinic, Dr. Petra Wiechel. A warm welcome to you, dear Petra.
Thank you for having me.
You're welcome. Last time we spoke about circulation problems, but we didn't manage to talk about cholesterol then. So that's what we want to do today, because I often hear from people that tell me, my doctor told me I have a high level of cholesterol. I have to do something about it.
Yes.
That they have to do. Is it so dangerous?
Well, I think if I were to write a book, the first thing I would do is to thank the cholesterol. I would call it cholesterol. Thank you.
The firefighters that put out every fire.
Well, not only the firefighters. Eventually, it is the most precious, most important building block for the cell membranes. A cell has a membrane which is like the brain is to us. Without our brain, our body couldn't live anymore. And if this cell membrane dies, the cell dies too. If the cell nucleus dies, the cell can still survive for about 4 to 6 weeks. That means the cell membrane actually is a speaking tube of every cell. This is where the communication happens. Here is where the metabolism happens. The exchange. Substances change. Potassium, calcium, magnesium, sodium, influx, afflux, efflux, and the cell membrane has to stay permeable. The cell membrane is building its receptors. That means insulin is docking there. Serotonin is docking there. If it can't dock, we can develop a depression. And the cholesterol is responsible for all these tasks. It is so meaningful that it is being made by the liver. That means our body doesn't want to risk that we eat enough eggs every day that contain a lot of cholesterol. Our body produces 80 to 85% of this necessary cholesterol. And I believe that the people who listen to us understand that our body does not make mistakes. That means if it has the necessity to make more cholesterol, it would produce it.
Then there is a reason, isn't it?
Then there is a reason, then it makes sense, and the cholesterol does have tasks in our body. We won't even notice that it is doing a big process of regeneration and needs more cells. Condition after a surgery, process of reparation. I can always see high levels of cholesterol after a heart attack. Well, of course, do you know how many stress hormones are needed? Cholesterol is the starting substance for hormones.
But don't they prescribe cholesterol-lowering drugs in those cases?
Yes, I'm telling you.
This is terrible.
I'm telling you, so terrible, because the cholesterol is a part of the cell membrane and of the inner wall of the cell is increasingly found in atherosclerotic plaques, according to studies. So it is more than natural that this happens. And it is more than natural, on the other hand, that we have to monitor a so-called vascular calcification, a circulatory disorder that are restricting the volume of our vessels. That's out of the question. But the point of view is too limited to believe that the cholesterol is responsible for everything. And just the cholesterol. The cholesterol is something when, for example, there is a fire every day, and I can see the firefighters every day, and I know that the firefighters were always involved in a fire, that I blamed them for the fire.
Well, of course not. We have to ask for the reason of the fire, don't we?
Yes, that's what we have to do, and the cholesterol has to be produced by our body, by the liver, and it has to be metabolised. I don't know any patients that have a low level of vitamin D, which is a hormone, and a normal or too low level of cholesterol, because the liver is noticing this loss and produces more cholesterol to then, with the help of UV light, replace a provitamin D in our body with an active vitamin D. And this vitamin D alone is responsible for 100,000 biological immune reactions.
Did I understand correctly? If a person has a lack of vitamin D3, they're in danger of having an elevated level of cholesterol.
Exactly. Well, it is not really a danger. I am thankful to monitor this as a doctor, because at least when I see that cholesterol is elevated, then I immediately want to know, do they have a normal hormone metabolism? If they tell me they are in a very stressful situation, then of course they need many stress hormones. Can they be provided?
Does that mean for our viewers at home, if they have an elevated level of cholesterol, that they should see the doctor and measure their level of D3?
Yes, of course.
And then it could be balanced?
Well, it will be balanced for sure.
That's unbelievable. I never heard of it. This is revolutionary.
Yes, however, it could also be that they are lacking DHEA, which is dehydroepiandrosterone. From the age of 40, we're not producing enough of it anymore. It is mainly produced by our adrenal glands.
So DHA?
DHEA. And if I'm in a very stressful phase, and it doesn't stop, maybe through the loss of a loved one, we all know stress is something that can be positive, but it can also be very negative. And I will unconsciously need stress hormones constantly. I will reach the point, this can be measured, at which the stress hormones are too elevated. Then we know the person is in the phase of adaptation, and then there will be a point, everything is limited, when the stress hormones decrease. And the body notices this. And now there is no more cortisol. If a person develops a hypocortisolism, when the stress hormones have to decrease, then the body will at first sacrifice the DHEA. After that, the adrenaline, and finally the cortisol. And these people will have had a symptomatic triad. They have fatigue, exhaustion, and absolute intolerance to stress. Even little is too much. And they have chronic inflammations. They can't manage them, but the body knows that it has to help. So first of all, it has to produce the building blocks. And therefore we need elevated cholesterol.
So it can actually not be analysed quickly, but it has to be monitored over a period of time.
Yes, and we also have to see as soon as it is in the position to get help, it stops the production.
So the course needs to be measured.
I also don't want to. In my 25 years as a doctor, I prescribed statins twice because it was people that had a genetic defect. They don't produce cholesterol times 100, 150, but we're talking about 300, 400, that if you are taking their blood, you can see foam cells. We have to protect those people. The microcirculation is massively damaged. But this is the exception, and a disposition in the family of a genetic defect also justifies protection. That's out of the question. This has to be optimised. But not just now, it is the drug which is sold the most, just prescribed after measuring once. I recently had a patient, she said she'd been taking them for 15 years, but it was fine. And we stopped it, we measured, and how can it be justified? We balanced it and looked in detail into the hormonal situation. Looked at the thyroid hormones, the vitamin D, and then In continues, the cholesterol is up here, but it first has to be brought into the hormone metabolism. It needs cofactors. What I regularly watch is that, for example, zinc is a trace element, which is important to 400 enzymes and very important for our immunal capacity, intracellular. There is a lack of zinc in the whole population. And the zinc itself, which we take in, for example, through leafy vegetables, broccoli and so on, will not be brought in intracellular because sometimes the receptor for zinc is contaminated with aluminium or something else. That means the cholesterol is stuck. I also have to understand the cholesterol metabolism. What about my vitamin B3? What about my zinc? And of course, what about my vitamin C? Because this needs cholesterol to be metabolized to a cell membrane or to a hormone. And if we look at it on a wide base, it is actually not a big problem and could be easily solved. And meanwhile, I have treated hundreds, if not many, many more people. Condition after a stroke, condition after all those things that are normally treated with this drug. But we have talked in the last episode about the importance of oxygen. The intracellular oxygen is processed in the energy production of our power stations. These are the so-called mitochondria. And if the mitochondria decrease their capacity, we call it a mitochondrial disorder. You can also call it cardiac insufficiency. The heart is not powerful anymore. And you can also say the pancreas is weak. You can call it headache and migraine. It is always on the cellular level, the least energy capacity that's behind. We have not included it yet as a mitochondrial disorder, but an interesting fact is if I take such a drug, this statin, then it has exactly the same metabolism path, intracellular, as the Q10. And Q10 is a motor for the energy metabolism. That means the cell can't produce energy if it is blocked. So every patient taking statins will have a lack of Q10. And we always measure that. And I ask myself, where is the responsibility for whoever is prescribing statins? Because they will cause defects on the cellular level. And the heart. I have asked myself for 20 years why we don't get heart cancer. It is an energy problem of the mitochondria. If I know that the heart doesn't have 1,000 mitochondria, but instead 4,000, then the heart has even more necessity of capacity to handle the energy metabolism because nature gave us an organ which is fulfilling a powerful job through our life. When the powerful job isn't done anymore, there is no more life. And that, for me, is the second worry for the people when they are taking statins, that they should always know their intracellular Q10 level. And this will be shown from the lab as, for example, 0.67 to maybe 0.8. I want to see patients with more than 2. And Parkinson's or neurodegenerative patients, I want to see above 4 because they need a high energy capacity for their regeneration. So there is still the phrase today, you can take it if you believe in it. An Italian colleague, a cardiologist, he's doing heart valves and bypass surgeries many years ago. He gave patients a high dosage of Q10 before surgery, and he had fantastic post-surgery regeneration numbers. He moved up on the bestseller list of cardiologists because he had absolutely no side effects. And especially this Q10, I like to give it to patients before surgeries or when they need a high regenerative capacity. But of course, this is also a standard value we measure regularly, and also other values that measure the mitochondrial energy capacity.
NADH, is it?
Yes, exactly. But as I said, cholesterol, we probably have to, it's been 70 years now that it's been said it is good and bad. It's the same with LDL and HDL. We also call this good and bad, and it is actually like that the LDL doesn't return. Recycle cholesterol back to the liver. And then this can actually cause arteriosclerotic deposits. That's out of the question. But to understand what is happening and help the metabolism with some sense, that it can regulate itself better, this is unbelievably important in my opinion. And we give all the patients a trilogy of drugs when they had a heart attack, as if to say, this will protect you from high cholesterol. And we don't understand that we have to assist our body every day in the adaptation, that it adapts to us, because we might need more of it today and less tomorrow.
I've heard before that older people have a higher level of cholesterol because there are more centres of inflammation that have to be treated.
Of course.
But that's good, isn't it?
Of course, and I prefer it 1,000 times if it's higher than if it's too low. And do you know what is done with the statin? What effect it has?
The statin in the heart, it's a tube that is pushed in the blood vessel.
No, statin, the drug that people are taking.
Mm-hmm.
It is blocking the cholesterol synthesis in the liver.
Oh, great.
It would be the same as if I wanted to build a house with small Leo, and I would say, but we won't need any bricks. We can imagine it like that. The cholesterol is the building block of our life. And with everything that has a faulty activity. That is over-regulating. We should try to understand this.
Well, this book title is genius. Cholesterol, thank you.
I think so, and I always think there is so much written already. I don't have to say it, everyone knows. But then I see this standard recipe after surgeries and when it is increased. And I'm asking myself, after 25 years, who actually needs it? But then I can see people with joint pain. If the mitochondrial capacity decreases, inflammations and such can't be settled. And they register it, and then we just have to look at what kind of drugs the patients take. And that is the first thing that has to be viewed critically. And how much can be regulated at once. And how thankful is the body that it gets assistance because it hasn't known it before.
I read a rumour in a book that the source of the misinterpretation of cholesterol is based on a study with a rabbit.
Yes, they gave the rabbit meat-based food.
I think it was eggs, wasn't it?
The rabbit has vessels like an eel. And the rabbit eats only plants. That means the rabbit wasn't adapted to eating meat. So then these atherosclerotic plaques will appear immediately. It is like that.
And it's still the same today.
Yes, but also us, as doctors, we don't question it. We always have someone telling us how important the medication is. This is the base of any continuing education. So it is up to us to go deeper into the subject, and we used to learn all this too. In physiology at university and in biochemistry, how these things have to interlock. And it is good if we question it. With which, well, they are fast-selling items now, which are implemented very well. Cardiologists have to give them because, and I don't even want to claim it for me to judge that, but I am also treating patients with these diseases, and I want to understand why the body reacts that way. And don't want to artificially decrease something that it might need. And I understood that, and I see that our patients are returning to a nice balance without side effects, and that is the most important thing to me.
I want to sum this up. If someone has high cholesterol, first of all, don't panic, but measure the level of D3.
Exactly.
Bring it up to a good level.
Get some light.
And exercise.
And light. D3 cholesterol is only being metabolized when you have, the people used to have 8 hours of light in the past. Today it's limited because the sun is not in the right angle. Everywhere north of Rome, you're not able to get enough light. And there's too little time.
So just taking D3 without getting light isn't working?
Yes, it is working, but it is better with also being exposed to some sun. Life wastes away without light.
OK, then also Q10.
Yes, and also in a high dosage, because with Q10, every packaging says 30 milligrams. And please choose a high-quality product.
Like ubiquinol.
For example, ubiquinol is metabolized much better, and you can start with even 200 milligrams. And then let it be measured to make sure that you are supplied well.
But if I take a cholesterol-lowering drug and do this by myself, could this cause an undersupply? Can this be done without a doctor?
This Q10 is a must. If I take cholesterol-lowering drugs, it's the same if you worked at a gas station.
I think nobody does that.
If you work at a gas station and I arrive with my diesel engine and you don't put any oil into my engine, then I can go another 10 kilometres before the engine is done. It's the producer's responsibility to tell me that my engine needs oil on top of diesel.
Let me ask again, is this the reality? Do people do that?
No.
Well, this is unbelievable.
And this is what makes me so sad. People get into this situation unknowing, and it's bound to happen sooner or later. And this makes me so sad, because these things have arrived in orthomolecular medicine, and it is a must to take a high-quality Q10 product when taking a cholesterol-lowering drug. And if you're not brave enough, then just do this for yourself, that you will have these values checked, please. How is the thyroid? How is my estradiol, my progesterone? It could be testosterone. I mean, how many men have a lack of testosterone and don't know about it? How many women lack progesterone and don't know about it? That means 1 or 2% less bone mass every 2 years. And osteoporosis, which will be a nice topic for a future episode, to explain people that it is about balance, composition, decomposition, and we need the knowledge. How can I influence the process early? In my opinion, apart from just taking calcium, which will not even arrive if there's no vitamin D, because the vitamin D opens the door to taking calcium.
Another thing, if someone is taking a cholesterol-lowering drug, they shouldn't just stop taking it after this episode because they hear about Q10 and D3, but should discuss that with a doctor.
I never want to be understood like that when I sit here. I just want to ask you to start thinking about it and start taking responsibility, to talk to someone about it who will understand you. If they refuse you, they don't understand, or you didn't deal with it. And I think it is often like that patients have dealt more with those questions. And what you definitely have to do is ensuring a high level of Q10. Let it get measured beforehand. And then after taking it to see that you are on a good level and reducing a statin in future or stopping it, while still having an optimum serology. This can only be done with a colleague's knowledge. And I would not just advise that without thinking, in general, not at all. There are always, every person, we have 7 billion people on Earth, but we only ever treat one, and this one is highly individual. So there can't be a general advice. But we know the effect of statin, and Ewa Grober wrote a wonderful book about it many years ago about interdependency. What does a drug do on the micro or orthomolecular medicine level And this book is always on my table, and I check if a patient is taking a certain drug, what will happen to them just by taking it. And this is vital and essential for survival while taking statins. That people take responsibility for also taking a good ubiquinone.
I'm so thankful that we made this episode, dear Petra. We really needed it. It really was something innovative, world-shaking, and I think for everyone at home, extremely important to listen to this. Thank you so much, dear Petra. And to you, dear viewers. You heard her. If you are affected by an elevated level of cholesterol, you heard what you should do and can do. But please always consult a doctor that knows what this is about and knows the correlations. D3, Q10. It's unbelievable what I learned today. That's it for today. All the best. And see you next time.